This episode of Mental is brought to you by Spas and More. Visit spasandmorestl.com for more information.
NWO, if you're looking for IT services or protection for your company's software, hardware, or anything in between, as far as if you need to get cameras for your building, if you need keypads for your entry, NWO is a one-stop shop for all of your technology needs. Not only do they have impeccable customer service, but when you call them, you get somebody right there in your own town. You get somebody that's going to pick up the phone and you talk to a human. So ironically, the best way to deal with the AI future is to talk to a person. You get that with NWO. So give them a look today. TRT treatment is something that's widely thought of as something that just gives you an edge. That extra beast mode in the gym, a little bit of push when it's needed, or just that testosterone feeling, right? But in actuality, TRT treatment goes way deeper than that. It helps keep you calm. It helps keep you patient. It regulates your mood by regulating your hormones. It's not just a treatment to go beast mode. It's a treatment to be a calmer and better father. As a business owner and a father myself, I understand all too well how much it's needed to become a little more patient and a little more calm in a world that's pretty chaotic. Go check out Prime Performance today. So today, before we begin, Jason, would you like to tell everyone a little bit about who you are now, what your practice is, and what methods you specialize in?
Yeah, sure. So first of all, thanks for having me on, and I figure. When we were going to do this, I was trying to think of what to say and all that kind of stuff. But we'll just appreciate you having me on, and hopefully it's beneficial for everybody out there. But I'm a chiropractor by trade. Started off, I graduated from Logan, and before that, graduated from Parkway North, where we probably originally met many years ago. But went out
in the 1900s.
Yeah, back in the 1900s. So we went to. I went to a small town in South Carolina right out of school, worked for a buddy of mine. About a year later, took a job in Paducah to be closer to family, so Paducah, Kentucky. Was there for 12 years, and then moved up here to help run the Ozzie Smith Centers. And so I'm the chiropractor by trade, but do help run the office there. We have physical therapy. We've got regenerative medicine, so we do platelet injections, cellular therapy, and all kinds of other fun stuff. So that's what I do every day. So it's a fun time.
Cool, yeah. And I bet, like most people, I'm pretty intrigued to maybe talk a little bit more about like the difference between platelets, cell therapy, that kind of stuff, where it borders on as far as like conspiracy theory versus like reality.
Yeah.
Right? Because I always get, whenever you say like, especially cellular therapy of any kind, my mind goes straight to Jurassic Park. And I'm like, are you guys recreating?
Yeah. That's the fun thing, is that a lot has changed since the beginning of that stuff. And so as a chiropractor, traditionally I enjoy holistic type things. So I try to look for natural solutions to any situation, right? If you're a hammer, everything's a nail. So, and that's the body philosophy that I try that continually adopt and evolve. And so stem cell therapy has come a long way, just even in the last 3 years. So there's definitely a lot to it, from anything from, like I said, the PRP injections, the cell injections into joints, and even IVs and inhalation, and just all kinds of different things out there that offer potential solutions for things that aren't getting solved otherwise,
Does that go into, is peptides a part of that whole thing?
Not really. The peptides are great too. The most common you hear are like the BPC 157. There's also the TB 500. There's different ones out there, and so this is peptides are synthetic in nature. The BPC 157 is made out of stomach gastric juices, and so it stands for body. Body protective compounds. Sorry, it took me a minute there.
No worries.
Stage fright, first time on the podcast. But so body protective compound, and made out of gastric juices, and so helps with healing, helps with just body function in general. And so it's a great thing to utilize if it is right for you. But peptides are kind of in that TRT world. A lot of the clinics do that as well, just to add another boost to anything that might be bothering them, or
more
specific
of a
to the
medication than it is a natural
You know,
aid?
back in the day, you'd probably. I knew a guy that ordered his peptides from Russia back in the day. So it's they've been around for a long time. It's just always been questioned, like the effectiveness of it and all that. Much like anything else that's not, you know, probably recognized by the FDA as you know, however they deem things, but definitely has its place in just letting the body do its thing. You know,
I've heard in some cases you can just buy that.
Yeah, no, you
the
can. The question is, where is it coming from and all
Right.
that. Like I say, my buddy used to, or I should say, a guy I know, used to get them from Russia, and I was like, if it works for you, you know, he's still alive today. So I mean, it didn't adverse reaction or anything inside
No
of him.
extra
So,
arms or anything?
no, nothing grew outside of that was unnormal. So
What about when you talk about different modalities and healing stuff? Because most people probably think of chiropractic services as I come in, you crack my back, and then once you crack, well, let me just regress. I think of chiropractic services traditionally as I come in, you crack my back and my neck, and now I got to come in forever.
yeah,
Is that your goal? It's
Yeah,
not your
no,
goal, right? Like you want me to
no.
get better so I don't ever have to come back.
Also, there's a couple of philosophies. There's a couple, you know, at the heart of chiropractic, there's a level of philosophy that talks about just when, you know, when you have stagnant, you know, a lack of motion in the spine, it can irritate nerves. It can cause other problems besides pain. One of the more common things that I'll find with people, and actually a guy, I'll tell you, there's a patient of mine, 81 years old, 2 years ago. He claims that my adjustment kept his heart going. And I was like, Mike, I don't know what you mean by that. Like, what are you talking about? And he said, man, every time you adjust me, I've just felt so much relief in my chest. And over Thanksgiving, I ended up having a heart attack. And, you know, it was an extended period away from, you know, the office or whatever. And he goes, I'm like, Mike, that's great, man. I'm glad you put that on me. But, you know, my goal is to make sure things just move well. And so if there's motion in that spine, there's no irritation to the different nerves. But again, those nerves can go to other parts of the body. So there is a lot of holistic side to that, you know, especially with, treating a lot of kids that have constipation, bedwetting, things of that nature. You know, and people say, well, why do you take a baby to chiropractor? They don't have neck pain or back pain. And really with that, it's more about function. And so there are many different levels to chiropractic, but your most common one you see is with pain-related issues. And so, yes, the goal is to get you out of pain, get you back moving, and then just keeping stress off the spine and letting the nervous system work the way it's supposed to work and uninhibited. And that way your body functions at an optimal level.
So what about things that people may not traditionally think of for chiropractic? Like, again, I'll paint the picture with myself. So my thought process has always been my back hurts or my sciatica hurts or something like that, then I should probably go see a chiropractor. But what I traditionally haven't thought of chiropractic as a good modality for is, am I having chronic headaches?
Sure.
Because, you know, like my pressure, if I get headaches, which is rare, but it builds here. It's in my back of my like where my stem is.
Yep.
Or like you're talking about bedwetting, constipation. What are some non-traditional things that chiropractic can help with that maybe people don't look for every day?
Yeah. So again, even in adults, you know, constipation is definitely one of those that goes hand in hand with a lot of like pain medications, like, you know, that can stop you up. But even if people are having, you know, that without pain medication, that's a real common one, honestly. I'll have a lot of guys with low back pain that also have low function in their sexual world. And so that can also be an irritant to something like that.
Or a circulatory thing?
Yep. Yeah. And just making sure everything's flowing free. Another thing is, like you said, headaches, allergies, sinuses. I do a technique where actually I get a balloon up in the sinus, you know, nasal cavities and open those up. So a lot of people that have had facial trauma, snoring issues, things like that, like it helps open up that and really help people breathe better. And so that was one I was sitting in the class actually learning, and the lady that ran the UFC training center in Vegas was there. And so the doctor asked, the instructor said, well, how did you find my class? Because she's a PT by trade. And she was there with one of the chiropractors that's at that facility. And she said, well, you know, Dana White wanted us to come learn this because every time a fighter has sinus surgery where they go in and do, you know, whatever they do, it causes microfractures in the nose. So every time the fighter gets hit after that, they bleed faster. So, you know, when somebody has their, septum deviated or any facial trauma, that balloon technique, endonasal is what it's called, it actually can help maneuver that around without, going in and doing permanent damage. Unfortunately, like some that do happen. So that's a fun one to do. Actually, I had a kid who hasn't been able to smell since he was like 4. And so I've been working on him for a while, and he's starting to regain some of his smell back, which has been cool. But he originally came in for back stuff because he'd been doing jujitsu, and that led into a conversation about not being able to smell and whatever. And anyway, I was like, well, let's do it. So we've been working on him. But that's another odd one that you'd probably not think either on that. So, yeah.
Because whenever I think of losing sense of smell in general, I always think of the Dewey Cox story.
Right.
For Walk Hard.
Yeah. Yeah.
Or
most common now is the COVID, losing your smell with that.
Oh,
but
yeah, long term.
Yeah. But that's a fun one. The balloon situation, I never thought I'd be doing that, but it's a fun one just because it has almost instant ability to help with breathing normally.
Would that help with like people who might use like a CPAP and stuff too?
It
possibly?
can, yeah. So the reason I went and had it done originally first was for snoring, So, and I didn't think that I'd really had a lot of facial trauma or anything, that I could remember that, But I do remember.
I fell down a lot as a kid, like most
well,
of us
yeah,
in the 80s
and
and 90s, and
of
you
course,
just keep going.
any amount of football, I played lacrosse as well, so like any amount of impact sports, stuff like that, definitely affects it, over time. And so, yeah, it's stuff you never think of. But anyway, I went and had that done, and I think I could breathe 20% better after the first visit. And I didn't think I had a problem breathing, but it was definitely more open. I got to learn how to do this, So,
Yeah.
and it's worked out well. The people that I've treated with it have all responded very well to it. So,
What about cell stuff? When you're talking about,
man, I could talk 10 times longer about that than just in the world of cells. There's so.
but I don't
much.
generally apply that to chiropractic.
No. So back in the day.
So do you have an MD as well, or how does that
Yeah.
differentiate?
We've got a medical side, and it started a long time ago. We were in my business partner at the time, Matt, and myself in Paducah. We had small town, great town, by the way. If you need to visit somewhere,
We're
awesome.
talking about Paducah a lot on the
Kentucky.
show, actually.
Paducah, Kentucky.
Strangely
Oh, do you?
enough.
Okay. Well, hey.
Because if you remember, I was saying that part of my childhood was in near Paris, Tennessee.
Oh, that's right.
It was between
Yeah.
Paris
Yeah.
and Paducah.
Yeah.
Or really, where's the racers? Murray
State,
State.
yeah.
So it's between Murray and Paris.
Yep.
Was the little town I was nestled in.
Yeah.
But strangely enough, I've had probably 3 guests that have brought up Paducah, Kentucky,
Yeah,
out
so-
of all the weird places.
It's a great town. Love
Yeah.
that place, and spent a lot of time there. But when we were there, it was, my business partner and I had joined his clinic, and very high volume chiropractic. We got to a point where we said, okay, well, how can we better help our patients? How can we evolve and keep moving forward? And first thing we added was physical therapy.
Okay.
There is a section of chiropractors that love to do rehab along with their stuff. That's not me. I just kind of look at myself as an old school chiropractor. I love to adjust people, love to move bones. And we do have physical therapy there to do the rehab for people with shoulders, knees, hips, back, any of that stuff. Because I just feel like they do a much better job than what I would, because I didn't take to the rehab side as much. And so as we had a PT, we realized like we're not really affecting the inside component of the body. And that's when we said, okay, well, let's explore the medical side. But we didn't want to do steroid injections. We didn't want to do trigger points. We didn't want to do your common like pain management type things.
Okay.
And so we kind of started with what they call these gel injections for knees. And so that kind of got us into that door that then led us down the pathway to PRP and stem cells. And so next step was the PRP. Platelet-rich plasma, so that's where we draw a patient's blood, spin that down, take platelets and plasma, and inject it back into chronic areas of pain to help with the healing and getting people back to life. And so that went well. And then
Because the platelets, much like the outside form of scab, on the inside they do the
Right.
healing part too.
Yeah, and a lot of times I tell people, I was telling a lady before I came here today, the goal of PRP, the effect, what we're trying to affect is ligaments and tendons, because those have very poor vascular accessibility after the age of 18, 19, 20 when we're done growing. And so a lot of the chronic stuff you see is usually a lack of healing ability within a joint. And so those tissues that lack that healing, they dysfunctional, which causes another reaction from a different tissue. And so when we inject that back in and bathe that area with the healing potential of the body, like it's able to then take that and run with it. And
Because
so,
most of our blood stays inside our vascular system.
that's right. Yeah, I had somebody ask me one time. They said, "Well, what? Like, how aren't we all just full of blood?" And I go, "Well, it's contained. It's not like you're a big pool of
Right.
fluid. It's all contained. So if there's no capillary going to that tissue, like it's likely not getting anything from it. So, and that's where ligaments, tendons, being able to inject into the areas, whether it's a joint, soft tissue, whatever it may be, to affect it in a very positive way, is what is that missing link to why somebody's not getting better. Yep.
Okay. What about kind of a quick breakdown that I think would be helpful for a lot of people, just a fun fact, is that the more I pop my knuckles, the more I can pop my knuckles, right?
Yeah.
It's air inside there.
Sure.
Right?
Yeah.
With the neck, same kind of thing.
Yep.
It's air.
Yep.
So the myth is keep popping your knuckles, they're going to get fat and you'll have arthritis.
Yeah. Yeah.
Or is that the fact? And what is it about popping, cracking necks and knuckles? It's almost like growing up in the 80s,
Yeah.
right? Like
Yeah.
it was, in my purview, it was always like before a fight, like you're like,
Yep.
and then pop, pop,
Yeah.
right? What is it? What is the reality behind popping knuckles and joints?
So I've probably been, let's see, I mean, I used to walk on my mom's back, like I used to, so I've been adjusting. I was just doing chiropractic since I was a kid. Didn't know it, but that's what I was,
Right.
doing essentially, I suppose. And I crack my knuckles all the time, obviously, and I move my neck around, I'll hear some cracks, pops, whatever. So I always joke that if it did cause arthritis, chiropractic patients would look like stegosauruses almost, and I'm exaggerating, but like a level of growth on that joint that, when you think of arthritis, you think of like an older person's knuckles being massive or whatever, to that extent. But, keeping motion into those joints and like I said, I pop them all the time. So you're probably encountering more of a hypermobility thing down the line versus a hypo. But, that's one of those that it definitely would be interesting to see the outcomes of a study, because I promise you it wouldn't necessarily cause arthritis. It may annoy your parents' kids, so keep that in mind as often as you may do it. But it's not necessarily going to cause a situation of arthritis, in my opinion.
Okay, so you heard it here first.
That's right.
Or maybe third, but
Yeah,
go ahead and crack those knuckles.
because I can't stop myself from doing it. I could stop I don't chew my fingernails anymore, but I don't. I can't not.
I'm a clipper on nails. I've always had a weird thing about my cuticles, because my mom used to like push them back with this little tool, and so it made me really weird about it. So I'm strange about anybody touching my nails. What about another myth that I've heard about, and then I want to dive into some theory in some places where you might have gotten that theory, just as kind of how you practice, who you are.
Yeah.
But the other thing is like micro fractures. From what I understood or believed up until this question, at least, is that that's filled in with calcium. And so, like much like on Bloodsport, when I was little, living in the small towns, there's nothing to do, I would punch trees.
Right.
Because you watched Van Damme do it.
Sure.
And the thought process behind that is, the more I get little tiny microfractures, then the harder my knuckles will become, because I'm making little calcium buildup. Is that a thing? Is a calcium buildup a thing with tiny fractures?
Well, and two, anytime you have an injury where there's broken bone, like there's going to be your body trying to heal it as much as possible. Yeah. So, and from a standpoint of, punching the, microfractures and all that, I'm sure it builds up some level of durability, but if you really fracture something or whatever, like it may turn into a potential weak spot down the road, depending on time, place, whatever, how old you are at the time.
Okay.
But I don't know that I'd recommend punching trees. I mean, I watched it too, and the kicking component, hitting that tree.
Those shins.
Yeah.
Still got sensitive shins.
I'm sure that, yeah.
I never could get with that.
Yeah, I'm sure there's a level of durability that builds up, but I wouldn't suggest it long term, just in case. Because again, there's no studies on that one either. So.
Okay.
Yeah.
Well, maybe that's something that you guys should head
We'll
up.
look into it. That's right.
Knuckle popping, and you guys can be like the myth busters of your realm.
There you go. That's another opportunity.
Oxygen-wise, for rebuilding, you talk about capillaries going to different places. Do you guys use hyperbaric chambers?
No, we don't. Those are great options. And generally, the ones that you see for like personal use and things aren't necessarily like a hospital grade. You can
like
get those
bag.
that are like, you can get those that are super high level atmospheres. But most of the ones that you that people have at a home level are ones you have to use every day. And it's, one that is great. We actually do use in the office on spot treatment type stuff with a class 4 laser, which helps bring blood flow, oxygen to the tissues, all that kind of stuff. So oxygen's great. Hyperbaric chambers are fantastic, but we don't use them at the office just because it's almost they'd have to come every day to get the benefit out of. But there's a lot of cool hyper wellness places that do utilize that, and I know that people take advantage of those as well. But definitely helps with recovery, just mental clarity. I'm sure just hyper oxygenation into the tissues is never a bad thing.
Okay. So that's a little bit about what you do.
Yeah.
Let's talk about why you do it. You've shared a story with me that I think was profound in my nature. And typically what I do at the end of a show is I like to talk about something that I'm taking away from this. But I would love for you to kind of share that story again with all of us listening and watching so that I can hear it again, for one. I think it was beneficial to me. And two, to give a little bit of insight of who is your chiropractor? Who is this guy?
Yeah.
Part of that was we were talking a bit about fortitude, mental fortitude, building up an idea within yourself that we can overcome hard things, right? And you had an experience that kind of set that apart for you.
Yeah, it's one of those stories that I always said I'm going to write a book or tell the story or whatever. Never done it until today. So back in 2000 and probably 12, because I think my daughter had just been born, and I was in a coaching group with. In chiropractic, there's plenty of coaching groups, and so this one in particular was called Maximize Living, and they had what they called a transformational camp, Camp 1, Camp 2, and all that. And so I went down for Camp 1, and it was down in Florida somewhere. Don't remember where it was, but I know we were next to orange groves. We're in the middle of nowhere. It was almost like you were in a trout lodge down in Potosi. Well, you didn't come till middle school. So this was a sixth grade trip that
my oldest son went to Trout Lodge, and then I do stuff with the Y now. I'm familiar with the area.
So it's kind of like
I'm thinking more about the battleground. When you told me the story, I pictured the battleground from Remember the Titans when they went to
Sure.
spot in Tennessee.
Yeah, there's a lot of volleyball sand pits that we did not play volleyball in, because when you're a chiropractor and you go to these transformational camps, there is a mental component to it, there's a physical component to it, and there is a chemical component as far as what you're eating and all that. And so it was a night, and you go down, you don't know what you're getting into. You just know it's transformational camp. So you're going to be practicing different scenarios with different patients with different problems and like all this, and working on efficiency and business stuff and all this mess. And so we go down, and one night, this was probably a Friday night, because we got there on a Thursday. So Friday night into Saturday, all of a sudden we're sleeping. It's probably 1 in the morning, 2 in the morning, something like that. And all of a sudden you hear all this noise. They come into the dorms there, wake us all up, and they're like, everybody get your shoes on, workout gear, shoes, whatever, get out the door. And so we're just like, oh my gosh, what? And so we go out, and they said, okay, here's what we need everybody to do. Form a line over there. See that wood pile? We need everybody to go to the wood pile and get a piece of wood. And we're like, okay. So we all follow suit, and there happened to be a gal in front of me. Her name was Renee, and she was one of the female chiropractors there. She was one of the coaches involved in that group as well. But when she got up to the wood pile, they tried to give her, it was a stump. It was probably, well, I know because I carried it, and I'll get to that in a second, but it was probably that big around, about that big, and it probably, I feel like it weighed 35 to 40 pounds. And so I said, Renee, let me grab that for you, because she might weigh 105 pounds altogether. And then they hand her what looked essentially like a twig after that, like what looked like a piece of firewood. So anyway, we go back to the circle where everybody's at, and the leader, Greg, who is a highly trained endurance athlete, he said, I bet you're all wondering what we're doing. And I had noticed, I looked around the circle before I started talking, I'm the only one that put their piece of wood down. Because everybody else had about, like I said, it looked like firewood, like, maybe anywhere from 5 to maybe 12 pounds at the most. And I'm sitting here with one that's way bigger than everybody else. So I put it on the ground because I'm like, I'm not going to hold this the whole time.
3 people were sitting on it because it's so big.
Yeah, no, it could have been a seat around the campfire for sure. And so Greg says, I bet you're all wondering what we're doing. And he said, we're going to go for a run. And I looked around, and I'm like, how we doing this? And he said, I want you to carry your piece of wood, and just so you know, like, I'm going to run out, and when I decide to turn around and pass you, you can turn around and come to this spot. So we have no idea how long we're running for. We have no idea anything except we are going out on this road and we're running, and then when he passes us, we turn around and go back. And so we start, and I'm trying to figure out how to carry this dang log, mostly because I'm competitive in nature, and I am not going to be last, and I cannot be last. I knew I wasn't going to be first, but I just decided, I'm like, I have to be able to beat the majority of the people that I know I can beat, and then whoever else is dogging it, I'm gonna do whatever I can. And so I put this log under my right arm, and then eventually I'm hurting, so I put it under my left arm, and then I finally put it over here, and then I move it to over here, and then finally somehow I realized I put it like a squat bar. I put it back there. And oddly enough,
Coach Kinney.
Yeah, shout out to Coach Kinney. Yeah, and I put this this log on my back like a squat bar. The only problem was the diameter again was massive, and so it forced my head down because I had to balance it on that spot. And what then came with that was. My arms eventually went numb because they're up here trying to hold it together, and when you're compressed like that, you stop blood flow and things. And so, hands went numb, arms went numb. I had pain, of course, and wasn't comfortable. And I'm just one foot in front of the other. The other thing was the way the angle that my head was at. I could have probably seen 12 to 15 feet in front of me. And that was it because it was just the angle.
Yeah,
and
down.
So, and unfortunately, or fortunately, this was a kind of a dark road. There was there were street lights every so often, but it was one of those that I'm just one foot in front of the other is all I could think about. And so, so eventually, I'm in front of probably plenty of people at this point. And then Greg passes me. And then I realize, now everybody's in front of me because whoever's behind me already turned around, and now I got to step it up because I'm not going to be last. So I get back to the circle. I was not last. I passed another handful of people that were already behind me. So I mentally felt good, right? Mm-hmm. And get back to the group, and everyone's like, "Oh, you can put it down. You can put it down." And I'm like, I don't want to. And they're like, "What?" I go, "I feel like my arms are going to rip off." Back in the original Mortal Kombat days when that one guy would just yank your arms off. Like I literally thought if I drop that log, my biceps are going to explode because they've been up here we ran for 45 minutes. And so I'm literally locked like that for probably 30 to 35 of it. And then to let go, I knew it was going to hurt. And so I finally just found a spot and I just let go and walked forward, and it definitely hurt. But it didn't last very long. And so we go back to bed. They wake us up the next morning for our normal stuff. And we had a reflection time where they asked us to reflect on the run and anything we learned, all this kind of stuff. Now, keep in mind, there were some guys that did not get out of bed. And so, of course, they didn't have anything to reflect on except them not wanting to, whatever, right? That's in their own heads. But from a standpoint of reflecting, this is like probably the first time that I remember, I think I told you, in old school when Will Ferrell's doing the debate, after he does a fantastic job, he all of a sudden is like, what happened? Like he had blacked out. And so I felt like this was that same moment. Like, I don't know where these ideas came from that I got from that, but they came out of my mouth. And I'm not somebody that shares stuff usually, like in a group setting, but there's always the people that always share stuff, and they were sharing whatever. And
it used to be those are the kids in class you didn't want because they'd ask 14 questions.
Right, yeah, they were the question askers and always like sharing all that. And so they had great insight. Like there was nothing wrong with what they had come up with. And then Charlie Majors, one of the guys, he's actually since passed away, unfortunately, from brain tumor, but great guy, real intense guy. And he literally goes, "Where's the guy with the big ass log?" And everybody turns and looks at me, and because it was that much different than everybody else's. There's no question here they were talking about. And I said, "Oh, that was me." And they said, "Well, what did you get out of it?" And I said, you know, what's interesting is reflecting on it after the fact. I don't know why I went through what I went through, but I do now at this point in my life. And so, you know, when you start off and you're going through life and you have challenges that come up, you're always trying to figure out a way to get through them, get over them, get past them. And so in this case, I thought to myself, you know, we all carry burdens, right? Whether that's for one reason or another, and we all have those to carry. And so what's interesting was I'm going through this, and mine was a big old burden, and trying to carry it differently. You know, I'm trying to figure out the best way to carry it. And then once I settled on it, you know, in that whole initial time, I'm not living up to my potential, because I can definitely run faster, but not with this big old log, and definitely not offset in weird ways and all this. And so it slowed my pace. It, you know, it distracted me, all these different things. And when I threw it up on the squat bar kind of position, I could definitely not reach my potential, but like I was more comfortable and all that. But what the problem was is that my vision is now impacted. And so I'm carrying this big weight. I lose feeling, like I can't feel my arms. I can't see, like all these things, but I'm still making progress. I'm making progress, even though it's slower than I'm used to. I'm still going forward. And, you know, when I got back at the end of it, right? And they're like, "Oh, go ahead and drop it." And I'm like, "I don't want to." And it's funny how much I already forgot how much pain I'd already been through. And what happened was, when I dropped the weight, the load, the burden, it definitely hurt intensely, and then it was gone. And so when I think about that, I go, okay, so when I have this huge burden that I'm carrying, and it's slowing me down, it's causing me to not perform at my optimal levels, and then once I get it in place, I can't see where I'm headed to, right? A lot of us have a vision for what we see in our life, and kind of that road we're going to go down. And all of a sudden I'm carrying this burden that just stops me from seeing. Still moving forward, but I can't see. And then I realized the very last thing, it wasn't my load to carry. And so I look at it and I was like, "No offense, Renee, but you're welcome," you know? And so, you know, in that, I remember that weekend all those years ago, and thought to myself, I don't know why I went through that, but I'm sure that's going to come in handy at some point in time. And so going through life, some things happened, you know, in my personal life, and it got to a point where I realized the burden that I was carrying was not mine to carry, and it was changing who I was, not for the better. And it was one of those that I had to put that load down. Unfortunately, that comes with repercussions, whatever, all that. And it was that log story that I thought back to, of like, now I know why I went through it, because there was all this ego in that situation that I thought I could save that individual. I thought I could carry the load. I thought I could do all this stuff. And it was it was just devastating my ability to go down the road that I'm supposed to be going down, in my opinion. And so that story definitely came to life, I don't know, back in 2019. And it was one of those that, as I think through it, it definitely helped just, gosh, look at things in a different light, because we all have people we want to help. And there comes a point where, unfortunately, it can affect you in a negative way, to a point where it's derailing you from the journey you should be on. And it's not easy to drop that load, especially when it's a loved one, especially when it's a wife, especially when it's a parent or sibling or a best friend, whatever it may be. And so it was one that just gave me reassurance that I'm like, I know this story, this journey I'm on, can't keep going down this road, because I'm losing feeling, I'm losing vision, I'm losing all these things.
And you know, when you drop that burden, there's going to be, no matter what, there's going to be that immediate pain.
Yep.
But that pain will pass.
Yep. And it'll pass a lot faster than the pain that came in the first place, because you don't really realize, some of you may be carrying burdens that are small, but they add up over time. And that's the challenge is, you can, shoot, you go to weightlifting and, that whole progressive overload at some point, 250 pounds doesn't feel as heavy as it used to when you started out on your lifting journey, you know? And so you get used to that load, and that's the tricky part, is that you don't see and you can't feel, you can't realize the impact it's having, because you're strong, you're tough, you're building up that durability in yourself, but you don't realize what you're sacrificing because of it. And so, yes, putting down that weight is super painful immediately, but it does pass quicker and you're able to move forward.
That's also kind of a profound thing that you said too about getting stronger, because life doesn't get easier.
No.
We just get better equipped.
Yep.
So that 250 pounds is always going to be there. It just can feel lighter as you're more prepared.
Yep. Yeah, absolutely. Because you definitely can, get used to the load. But there are times that's okay, and there's other times where if it's starting to cloud your vision and starting to impact all those different parts of you, that's when you've got to stop and be like, okay, what's happening, and have that real talk with yourself.
And that's where I see this kind of too, where I thought it was profound even to hear the story. So thank you for sharing that. Thank you for sharing it to, for everybody to hear. But one of the things I really took in consideration about that is the knowledge of, is the path thing, right? Like not being able to see your path. Many times in my life, I've had this vision of what the future is. And when that's altered, it's hard for me to readjust.
Yeah.
Whereas if I let things go, and I'm no longer concerned about it, and I spoke about this like a year ago, but I've kind of lost my way in between there a couple of different times, as we tend to do, ebb and flow. And I think I've just now gotten to the point in my healing journey where I'm okay with those ebb and flows.
Yep.
Because I'm like, no, I'm healing. Now I got to start over. It's like, no, you don't. You can start right where you're at.
Right.
Keep going. It is that I kind of started viewing things like a river, in the sense that it's my job to paddle my canoe, and I can go to the shore and I can rest. But no longer am I worried about what's around the river bend or where the end of the river is.
Right.
Because those things are out of my control.
Right.
And when those were my primary focus of like, oh, got to get there, got to finish, got to do these things, which is why I think that was probably such a profound moment, is because like when you began that run, you can't make excuses, or you can't fundamentally put a light at the end of your tunnel, because you don't know when that run's going to stop.
No. Nope.
Until he passes you. And even then, you got to quantify now, how far have I come? I've got to come back that far.
Yep.
So like going blindly into life with a burden that isn't yours to carry is really profound in a lot of ways about life lessons. So
because I think we all carry different things, whether it's, you can acquire them or just be born into problems, right? And however you see those, but you got to realize what is yours and what is not yours. Mm-hmm. And, it was definitely one of those that I reflected on a ton and still do, because, when, again, like you said, like I've been through such crazy things in my personal life that, having that to reflect on allows me to kind of get centered again and realize that, hey, we're back on the journey. We're headed this direction.
This too shall pass.
But at the same time, enjoy the day.
Mm-hmm.
And win the day and move forward. And that's really what gets you down to where you want to be. And again, you don't have to, you can focus on the end, but realize that that journey is the biggest thing that matters in your life,
Yeah.
So.
Excellent. Well, Jason, thank you so much for joining me today.
Yeah, absolutely.
Thanks for coming on and sharing that story. Where can folks find Dr. Brame at if they're looking for to smell again?
Yeah, so we are in my office, the Ozzie Smith Center is in Chesterfield, right down from the old Chesterfield Mall, so right at Clarkson and Baxter, 16216 Baxter Road. Actually, a car just drove into it this morning. It's been a crazy morning. But just a public service announcement. The gas is on the right, brake is on the left. So just remember that. And but we're in that building, Suite 300, and it's super easy, convenient access, but that's where we're at. So if you need anything to make yourself feel like you again, that's one of the places to call.
And we'll put the link below in the description so that you can find it easy enough. And hopefully at a later date, we'll be joined by Dr. Brame again. And until then, we will see you all next time. Thanks for watching. And remember to follow, subscribe, and like.
TRT treatment is something that's widely thought of as something that just gives you an edge. That extra beast mode in the gym, a little bit of push when it's needed, or just that testosterone feeling, right? But in actuality, TRT treatment goes way deeper than that. It helps keep you calm. It helps keep you patient. It regulates your mood by regulating your hormones. It's not just a treatment to go beast mode. It's a treatment to be a calmer and better father. As a business owner and a father myself, I understand all too well how much it's needed to become a little more patient and a little more calm in a world that's pretty chaotic. Go check out Prime Performance today.